Hello, everyone. Welcome to this edition of 12 on Health. Our focus today is what women need to do to take care of their bodies. For starters, make and keep important doctor's appointments. And with all that's going on, and with all the responsibilities women take on, they often ignore the signs that something isn't right. Our guest now, Dr. Brian Sheets of Ultimate Solutions Wellness Facility in Darien, is here to point out some of the practical information that can help you get a handle on your health instead of waiting until there's a problem. And do you find women sometimes just wait, they're kind of put themselves bottom of the list?
They do. Oftentimes, deductibles start to run out toward the end of the year. So it's a good reminder for people to, if they haven't used up their deductible, they'd like to get in before the first of the year. But as you're saying, oftentimes they'll stack up the children, which is a great thing, but they have to keep themselves healthy too, is exactly right.
So they're taking care of the kids and whoever else is in their life before themselves, or canceling an appointment because someone else has a demand of their time.
That's right.
Mammograms, you say don't ignore them. You were pointing out, and other doctors do too, that within a year's time or within just a couple years' time, something can grow and become concerning.
Right. And, things that are palpable, patients can find. The evidence is about 60% of breast masses can be found by patients doing self-breast exams, which is very encouraging. But they have to keep up with those, and oftentimes they won't. Patients they'll say things like they're afraid they'll feel something, or they're intimidated thinking there's more work to it, they won't do it right.
Okay.
So the importance of mammogram is they really need that also.
And with the mammogram, they find it before you can feel it.
Absolutely. Breast cancer can be there 6 years, if you can believe this, 6 years before the cameras can find it. So technically, it's a very slow growing cancer. But the importance of getting a mammogram, and now coupled with ultrasounds, just like our cell phones take such great pictures, ultrasounds have gone through the roof. So they are finding cancer with ultrasounds. And I hope patients aren't nervous if they've always had normal mammos, but then suddenly the radiologist or their doctor says, we'd like you to get an ultrasound also.
Yes.
It's an excellent adjunct to the mammo.
And who is most appropriate for that? I understand it's women with breast tissue that's quite dense.
You know what? Yes. We used to talk about fibrocystic breast disease, but now that the cameras are so much better than they used to be, we've dropped the word disease and called it fibrocystic change, and that makes a breast very dense. So the rule of thumb generally is when a woman's breasts are 50 to 75% dense, the mammo can see things pretty well, but when the density increases to 50 to 75%, we'd like a supplemental sonogram also.
And that will be covered by insurance?
Almost always.
Okay. A lot of women will go for their imaging, whether it's ultrasound or the mammogram, and something is found, but it's almost as if so often something is found and it turns out not to be concerning.
That's right.
What is going on? I hear people say they have a cyst, but it's not a concern.
Yes.
It sounds worse than it is.
What's happened is the tissues in the body that for years were making and transporting milk aren't needing to do that after the age of 40 and so forth, when mammograms are considered standard of care and we want them annually. So on a visual level, and we didn't see this so well before the cameras were so good, and they were still healthy patients. So if you have a healthy patient where the camera couldn't see these things before, nobody was alarmed. We're just noting them now. So fibrocystic change, these normal changes in breast tissue from milk-producing glands and ducts to a little more sporadic, what we call dense tissue, is the normal, but we don't want something hiding behind that. So,
and if it's a cyst, if it's determined there's a cyst, does anything need to be done with it?
A cyst aspiration is where a very slender needle is placed in the cyst and the fluid is drained. And there are guidelines to analyze that fluid. Typically, a patient, and I've had them just this week, where if about 2 centimeters of cyst area is there and it's compressing a nerve, that will be painful. So cysts are one of the things that, although small ones are seen intermittently on mammogram, larger ones or ones close to a nerve will be painful. That will send a patient in. Most simple, and that's a classification, simple versus complex. Most simple breast cysts are benign.
So you just leave them?
Or maybe aspirate them. Maybe if they're found and they're painful, that's a reason to put a slender needle in and drain them.
Okay. Another issue for women, Anemia.
Yes. Yes.
It's not just, and I know people who eat well,
Right.
they eat by the book,
Yes.
nutrition-wise,
Yes.
but yet they still have anemia. What are the signs? Because a lot of women ignore if they're exhausted.
Well, but you hit it right in the head. If they're, you know, the busy schedule people have, they write into their day, and I'm tired after 2 p.m., so
Right.
to speak. So they get used to that, unfortunately. The #1 cause of iron deficiency anemia in reproductive age women is a heavy period. So it behooves us, for the doctor, to get involved in that. For years, the internists, rightfully so, were giving iron, we're analyzing women's blood. Now that we have a sense that we can do something about it, I happen to be a gynecologist, as OBGYNs, we can do something about that proactively with birth control pills. It's what we call a non-contraceptive benefit. And anemia, preventing anemia, reversing it, and preventing it is one of the things we can do with birth control pills.
How does hormone therapy help prevent anemia?
What happens is the lining of the uterus every month is hoping for a fertilized egg. But most times in a woman's life, right, you think about it, it doesn't get a fertilized egg. So the lining grows up to about 1 centimeter, and the uterus, what I describe as a flask of muscle, will then, if you will, like toothpaste from a tube, push that lining out that isn't needed. That's the blood loss. So what a birth control pill will do is basically work with 2 actions. One is to prevent the egg from being launched, ovulation, and secondly, to make a bad nest. So if you have a real thin lining, a poor nest, there won't be a baby produced when it isn't the right time for the patient. But if you can thin that lining, and that thinner lining is what's pushed out, less lining, less bleeding, and less cramping.
And one last question on the whole hormone replacement thing. While there was a concern,
Yes.
studies a few years back alarmed
Right.
people, and a lot of
Right.
people just said, no hormone therapy for me. You're saying there are now kind of prudent ways to do it, making sure that with the estrogen you also balance it with other hormones.
Yeah, any woman who still has a uterus, right, who hasn't had a hysterectomy, absolutely needs progesterone with the estrogen, and that commensurate dose can be figured by the doctor. One of the concerns that we had for years is a study was done that showed after the 5th year of hormone replacement, select women, and there was the controversy in the study, how well the original study was done, will show an increase in stroke and heart attack.
Okay.
The way most of us were trained was the idea was that you'd start someone in menopause, the average age being about 51, 52, and they'd go on really for the rest of their lives for hormone replacement. That was the original thinking. Study came out that concerned after the 5th year this increase in stroke and heart attack. Well, in Denmark, they very quietly on their own did a 10-year study that has now come out where they have shown that they have shown half the risk of heart disease, cardiovascular disease in those that were on hormone replacement.
For 10 years.
For 10 years.
Half meaning
It was cut in half. The people
literally less than those who are on no hormone replacement?
Yes, they had a control group, the randomized control, where
That's
neither the doctor
amazing.
nor the patient knows which medications whether they were on the placebo or the active medication.
So inevitably more studies are getting started right now, if they're not underway already.
That's right. You know, one of the things that bothered us when the original study showed it must be stopped when they were following women into the 6th year, although some evidence in what we think were probably poorly picked patients showed an increase in stroke and heart attack. In addition, very important point, into that 6th year, they were starting to see, while on hormone replacement, a decrease in colon cancer and a decrease in type 2 diabetes.
Isn't that interesting?
You understand? So into the
Right.
6th year, there was an improvement in 2 things, and it was always a shame that they couldn't go further with that study, so that other organizations are putting studies together that are longer is very helpful.
So this is interesting. Maybe we're going to wrap up here, but it may be worth revisiting this with your doctor.
Absolutely.
Thank you so much, Dr. Brian
My pleasure.
Sheets from the Ultimate Solutions Wellness Facility in Darien. In just a moment.